Thank you. So we will call the meeting to order. And our first agenda item is approval of the June 15th Zoom video as minutes. Can I get a motion for that?
So moved.
A second?
I'll second. It's Melissa.
Thank you. All in favor?
Aye.
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 Aye. That is unanimous. Thank you. All right. So we're going to go first to our departmental updates with Dr. Motti.
Well, good morning, everyone. Today will be a hodgepodge of things. I'm gonna mostly be setting us up for some future updates. So for those of you who are new, I think the first thing I'd like to do is just to give people awareness, if they don't already know, that the department's fiscal year goes from July to July. So the budget process is very long, and we don't really know what our final budget is until very late in the prior fiscal year. So I will be coming to present and just to discuss with you the budget for our year at our next month's meeting. We'll prepare it for you because we only got that paperwork very recently and there was no time to prepare it. So that's something to look forward to. We did not get everything we asked for, but there's some critical things around strengthening our fiscal infrastructure that were encouraging that we got. So 3 new contract compliance officers. Our budget is 52% grant funded, and we have a heavy load of contracts and subcontracts that have been dealt with by a very small fiscal department, which has not, in my mind, historically put them in a position to win. So as some of you know, but all of you should know, I used unpaid salary money to bring on an accounting firm that have been working with us for the last year. They have done fiscal monitoring for us. They're building SOPs, standard operating procedures for us, and they've been building critical infrastructure. We, for the first time in the department's history, have an invoice tracking system and some other pieces to really help. We've also grown the fiscal department. Recently onboarded a grants manager, a secretary, and we're welcoming a new accounts manager next week. But this new budget will also add to that team 3 new contract compliance officers that will be embedded in the programs to talk directly to fiscal, so that there isn't a burden on managers who don't have that level of expertise and training to have to do contracts and scope of work and things that they've currently done, and again, doesn't put them in a position to succeed. We'll also have a contract specialist. And so to that end, we'll also talk to you about a retreat, the first ever fiscal retreat we're having. The commissioner who's just got back from vacation today, so isn't on the call, but she has done a phenomenal job in leading the first ever type of fiscal retreat to really work on building team morale and support, working on team culture, and getting to the heart. There's a lot of changes that have happened, so we want to make sure that everybody's doing okay. So that's something I'm really looking forward to. So next month's meeting will be very fiscally heavy. We have been involved in a lot of, part of transitioning from the endemic to the pandemic to the endemic phase is just getting out there again. And so the team has been very active in the community. Pride Fest in June saw our HIV prevention team, the new Behavioral Health Bureau was out. And the numbers from that were astonishing. We broke records. We were one of the most popular tables. I've never seen anything like it. Usually at like big events like this, people are not checking for public health, but the team were so thoughtful about the types of things that they were giving away. They had a safe space for trans individuals during this really terrible time for them in our state. And had a place that they could come and be joyful and take pictures in front of a banner that represented the trans community. And that really, I think, was one of the biggest draws. Just thoughtfulness. They had games. People could come and so guess public health games, statistics, and then be rewarded with some giveaways. We, in next year's budget, also are going to have a dedicated position for a community outreach coordinator, because all of the programs are doing their own thing, but there's no real coordination. And I don't know that there's always awareness about how to build on those and partner with other people. And so that is only going to get strengthened. But I just wanted to shout out the DOH team for a beautiful and very successful Pride as well. If you'll excuse me, I think I have some of those numbers in the notes. I may not. Yeah, we'll have them for you in the narrative version that we have. I also work, many of you may not believe that, but I also work. So been really trying to get the department's name out there, really being a sort of beacon for public health right now that's in crisis. We lost more than 38,000 workers by the end of 2021. And I think those numbers, once we get 2022 and 2023 numbers, will be even higher. So spoke at Johns Hopkins at their recent division, talked to you about being at AshCon, the phase 2 launch, and there was an incredible public health festival that was put on by one of the emerging public health leaders, and SLU, Dr. Juliet, who's an HIV researcher and advocate. I don't want to butcher her name, so I won't. And she's a close friend, so I don't mind calling her Dr. Juliet. Everyone calls me Dr. Mati. And then last but not least, our team also hosted a men's health event that was incredibly well attended. We had prostate exams, we had health blood pressure checks, we had COVID vaccines, and we had fresh food for free for people to come and get. We had a bunch of partners. You can see the picture in the main part there, who came to also promote public health. So big, well done to our Family Children School Health team. We continue our employee spotlight. So when you get the bulletin, please take a look and learn more about James Lott. One of the just most joyful, not complaining people I have ever met. Just helps out wherever he can, always has a smile on his face. And so we wanted to spotlight James this month. While I know you guys will read this at a later date, this is public, and I wanted to give him that public awareness because he's a very quiet but very team-oriented person. So congratulations to James, our employee spotlight for the month. COVID numbers are dramatically down across the board, but with it, a concern that especially people who are highly at risk don't understand that with the lifting of the public health emergency order on May 11th, the free services, specifically vaccines, testing, and even treatment, are not guaranteed to be free anymore, and people need to be insured. And even then, it's not guaranteed that those services will be free. So we continue an average of 2 to 3 COVID vaccine clinics a week, and we're providing gift card incentives to help people who for whom that's a burden, who need transportation costs, and skipping work is an issue for them. The rest, I think I will leave to the report. I do think we need to talk a lot about sexual health, and you'll continue to see dedicated pages around sexually transmitted infection. Congenital syphilis and syphilis cases in females did decrease in June by 50% and 7.7% respectively. But overall, since 2016, we've seen over 300% increase in syphilis and 600% in congenital syphilis. So we're still in what I would classify a sexual health and STI emergency nationally and regionally, locally as well. But chlamydia and gonorrhea continue to have high STI rates. So in thinking about where to draw your attention in the report, please pay a lot of attention to the STIs and sexual health sections, and definitely reach out. We can have more conversations if there's ideas. We're hiring, we're definitely hiring. So we've hired 87 people since I joined. We had some departures, more departures than we've had recently. We've been averaging 1 as we've been working on retention, but we did lose quite a few. And so it's just a reminder that that turnover rate continues to make it difficult for us to really grow as a department, since we're constantly onboarding folks. But I want to congratulate Shantae Fluton, who's on the call, our new onboarding plan standardized to really increase the chances of people being successful here has been rolled out. And so people will have a very clear and dedicated schedule. There will be check-ins when they start within a few weeks, and then at a 3-month period as well. And they have frequently asked questions, maps, and pages and pages of phone numbers, resources, and website for a host of different Department of Health and public health related things to really help with retention there. I will likely stop there and take questions, but want to make sure I haven't left anything out. As always, please, please, please draw your attention to the very made easily available for you current job openings. We keep those current for you to share with your listservs, and they are hyperlinked both in the PDF version of the PowerPoint as well as in the PDF version of the narrative for you. Funding. We are now, we have a new RFP for community health workers. This is imperative for you all to get out. We had an amazing presentation last month about the importance of community health workers. So now we at Department of Health are putting our money where our mouth is, and we have up to $500,000 available. We desperately need these folks. They are the true working arm of public health, and with our priorities coming out of the pandemic of behavioral health and maternal child health predominantly, with everything else, as you know, so much of health and public health went to the wayside or was ignored in COVID. This is a wonderful opportunity. And I can announce that our 2 vans, if you haven't seen them driving around town, are active. They have beautiful Department of Health blue, white, and Black logos. And with our community outreach coordinator, high-level management position opening in the next month, that person will be responsible for making sure that the community health workers, the bus, is working. So this is a big one that we would really like for all of you to email out and get us some applications for community health work. So I will stop there. I see there are already questions, so I will allow Serena to manage those.
Oh, my mic was muted. Sorry about that. Tim.
Dr. Madi, thank you as usual for your report, and for one of the things I always love is how you call out your colleagues. It's great, and I love seeing this report after it comes out after the meeting. And I think you answered my question, but I'll ask it anyways, just give you a chance to punctuate it. Is, you know, at the risk of saying, you know, COVID is behind us, I don't think it is, but you know, it's sort of our new normal, making sure that we vaccinate against COVID and other infectious diseases. I've been on this board before COVID, and I'm curious about what you would say is the emerging, you know, or the front and center public health issues that we really need to focus in on. You mentioned maternal health, mental health. Is it workforce? Is it gun violence? Is it disparities? But, you know, STIs you mentioned, you know what, that's a long list, but you know, maybe it's all the above.
Yeah, I think if we're keeping it real, it's a fantastic question. Public health and health are on fire, right? We are coming out of a historic pandemic, and everything was and needed to be, at least in the beginning, specific, you know, predominantly, but throughout, was COVID centric. And so everything took a hit, right? So where I get criticized, well, let me not give a few people a lot of credit, where the few people that criticize in ways that I don't think are particularly helpful, I think they're folks who understandably feel like, well, my passion is overlooked. My passion should be the priority right now. And if I'm being honest with you, people meet with me to talk about gun violence. That is a priority. People come to talk to me about mental health, right? That is a priority. People talk to me about the opioid crisis. That is a priority. Maternal child health, that is a priority. But if you look at disparities across conditions, high blood pressure, diabetes. You can make an argument for all of these, right? So it's unfortunate that we even have to list priorities, because in honesty, we have to get back to the work of public health across the board. But I do think that for us, we are unapologetic about saying that specifically behavioral health, which never had a presence in our department, which never had a workforce, I need to definitely focus on giving that bureau the best chance of starting their work and doing so strongly to address the significant challenges across behavioral health. Because if I were to task everyone on this board to sit down and define the behavioral health or make a list of things that are encompassed under behavioral health, it's extraordinarily expansive, right? So their work is critical because it covers a host of different things. Maternal child health has been an ongoing issue with incredible disparities in our states for years, made worse by the overturning of Roe v. Wade and the impacts, obvious and not obvious, that people did not anticipate. And so I'm unapologetic about naming that as a priority as well. And then I do think that it was important for me, Serena really championed this. She doesn't talk, our chair, I get a lot of credit, but I do think we talk about, and she likes it that way, the quiet but mighty work that Serena does currently and has done for years in the region. And one of those has been really holding the city to address gun violence in this country, and in the city. And so that Office of Violence Prevention, she's worked closely with me and Will Pinckney to make sure that that was created so that the burden was not on the health department, who also didn't have one person hired to do that work as it was subcontracting and contracting out. And so I do think that since that office has been stood up for the past year now, we've seen really important, coordinated, thoughtful, intentional, strategic approaches to violence prevention that Department of Health collaborates with, but that Will Pinckney leads in. So Serena's already talked to me about bringing him back. He visited once in the last year and a half when we were kind of thinking about the office and it was in its infancy, but we have invited him and he has accepted to come back at a future meeting just to give you all a presentation about what the office has been up to for the last year and how we would like to see Department of Health and the Office of Violence Prevention continue to grow their work. So those are three main priorities, but I didn't even talk about the fact that we clearly didn't learn from the pandemic. So the emergency preparedness needs to be shored up. And so I know, I have my emergency preparedness supervisor, who's brilliant, Scott Gary, under the leadership of Justin Hauser, has just put on my desk an over close to 200-page document around our emergency preparedness plan for the city. He's also the safety officer, so we have to work on things like that. So I would say those topics, but in parallel with those topics is much needed critical infrastructure and thoughtfulness around how to continue to strengthen public health in an environment where public health is not supported at the level it should be. Very long answer, Tim, but you poked the bear. This is a topic that any of you who've known me for the last couple of years know gets me riled up. So if there are other priorities or things you haven't heard me mention, though, as a board, I'm very open to you all letting me know or bringing those up at this time.
Do we have other questions? I have a question, so I want to make sure I give folks space. There are other questions. So I know that when an RFP is announced, you do a great job of sharing. We have this funding available. And I heard you say that the budget is still being finalized this month. Is there kind of a future plan to have an annual calendar of RFPs so we'll know what the timing of different types of work will be? And that could help organizations prepare for, well, we know in September, we can apply for funding to do X.
That's a brilliant idea and one that I haven't thought about, which is why I just love working with you. I would say that only 30%, probably, and I'm just making that number up, but I think a minority of the funding streams we have available are that regular that we could provide a calendar. We could do so with a little caveat that is subject to when they actually get released from the federal and other agencies and other things that sometimes can't make us spot on the day. So As
We got
long
less
as,
than 10 minutes. Turn it off.
as long as
Honey,
people
we gotta
are,
go.
as
We
long
need
as,
you to wake up. Come on.
And while
Okay,
your
come on.
microphone is on, and I don't know if it's,
okay. So as long as people are okay with the range of time, as well, I think that would be enormously helpful. For the most part, though, Serena, we are just out here looking for money, grabbing money where we can, and then trying to get money out here. But I do think a calendar is something that is a beautiful idea and one that we could work on while we have Armamino on board, working with the fiscal team as well. Because you're right, I think that could help people for where funding streams are stable. But unfortunately, we don't have, most of our funding streams are not ones that we know about in advance. Craig, you've been here for a while. Is that a fair characterization, or do you think they're actually more predictable than I'm making out?
No, I think you're right. I think in the CD area, definitely more regular. There's some from the state that are regular. The whole COVID thing has thrown things for a loop in terms of regularity.
Yeah, but I think even with the minority, I think that's a great suggestion to forewarn people, because you're right, we have missed out on applicants because of that. But I do want to shout out the new Behavioral Health Bureau, who spent the first year with the CDC sort of being the transitional team, meeting with over 100 partners regularly for over 50 meetings, and took their priority list of what they wanted from Department of Health very seriously. And one of that was money. So we had 3 RFPs out. As you all know, we've had over 20 applicants total, and we're at the final stage of finalizing those. So we are getting money back into the community. But I really love that suggestion. Thank you, Serena.
Linda, your hand is up.
Hi, thank you very much, Serena. Dr. Marty, thanks for a very helpful presentation. At our committee discussion last month, we were talking about the rising incidence of violence that we've seen in our city's youth and teen
Yeah.
populations.
Yeah.
And I just wanted to ask, is there a particular place in the department where we have the bandwidth to address issues related to either behavioral health in our youth populations or in our preventing violence initiatives? Or do you see that as part of the department's work at this point?
Yes, it is very much so, but the leadership of it is intentionally housed both in the new Office of Violence Prevention that I spoke to a little bit earlier. And then we have a lead for youth and youth services embedded in the mayor's office. A colleague by the name of Lakeisha Robinson, who I can also invite to a future meeting. And so there is intentional leadership and work at the city level happening under Lakeisha and Will at Office of Violence Prevention. I'm happy to have them join and we can talk about how we support that. But my bureau chief for the Behavioral Health Bureau, as well as the bureau chief for Family, Children, and School Health, are embedded on some of their monthly community meetings and the work that we're doing. So if you see on socials, we've actually been promoting a lot of youth prevention around violence events. The rec centers in the city have been opening later. They've been intentional. We've been providing free food for youth through the city and have been very vocal about that. It's been in the press. And so we're continuing to support them, but I'm very thoughtful about not creating my own leadership streams in a silo within public health when there's already very specific leadership around those intentions. So again, I would say that Office of Violence Prevention and Lakeisha Robinson's leadership have been taking the lead, but my managers have to meet with them at a regular basis. We, for example, staff, they have monthly Office of Violence Prevention where youth are invited. There's some beautiful images. I can actually share one from this most recent event. Just give me a. So every month, for example, the Behavioral Health Bureau and other folks go to support the Office of Violence Prevention's event where they invite youth. So this last one, they had some video games where youth could play. They had speakers, they have mentorship for them. So there is a lot happening at the city's level I'm missing this picture. I'll get you, it's within the report. You'll see it within the report, Linda, but does that help, or do you still think? there
Yes,
should
no,
be-
that helps. That definitely
Okay.
helps. And
Okay.
thank you very much.
You're welcome. And thank you for paying attention to that, because you're right, there has been a significant uptick in violence, and I think those of us who pay attention to the press have seen what that looks like.
Melissa, your hand is up.
Yeah, good morning, everybody. Thank you for the presentation and the shout out to the team members for all their great work. This is just a comment. I wanted to thank Dr. Gary and the Behavioral Health Bureau and her leadership. You know, with the severe weather that we've been having in the heat, often think about our unhoused population. And, you know, a lot of those services kind of go between maybe the Department of Health, but more specifically Health and Human Services. And I know she's already outreached and started to work with that department. So just want to thank her for that intentional collaboration for that population.
Thanks, Melissa.
Thank you. Thanks for shouting her out, Dr. Tepe. It's not hard it's not easy being the inaugural bureau for something as significant as behavioral health, but she's really hit the ground running. And I agree with you. I really wish that we had one health and human services department like a lot of cities do. I think there's thoughtfulness about that, and I've brought it to the mayor's office in the past, because we lose the capacity to be able to really work together on initiatives that are clearly under public health as well. But their new leadership, who I can also invite to a future meeting, Adam Pearson, is just a beacon, an incredible leader who's done this work. And specifically, his background is within the homeless environment, as many of you may know. So I'm very confident in A, his leadership, and B, our ability to collaborate. We've already started collaborating. Just we're on some emails this week where our bureau and his department are going to be taking the lead in some trainings, some behavioral health trainings for our police officers within the next couple of weeks, which is long overdue. So I'm more confident in our ability to work more closely together. But yeah, I do wish we were one department. That split makes it difficult to collaborate all the time.
Emble, your hand is raised.
Hi. These are overwhelming to think about. And then I have another thought for you.
Mhm.
What are we doing about workforce? Because it seems like there's so many things to do, and you highlighted workforce is still a challenge. What should we do?
Let's
I
start
have
with some
ideas
good
that
news.
are not appropriate, probably.
Yeah, let's start with some good news. We're going to stay positive on
Yes.
this. Because workforce really just is the toughest, right? And it's for obvious reasons. Y'all know pay is the number 1, 2, 3, 4 to 10, right? And then that city living requirement has been a challenge. We are hopeful that the city living requirement may no longer be a challenge in the near future. That's all I can say. We are hopeful, very hopeful. And I think that will make a significant difference for us, because just that is just silly. Inability to hire people from the county and surrounding counties who are more than happy to work in the city and work for the city does not make a whole lot of sense. So, and as some of you may or may not know, it was narrowly shut down at the last election. And I don't know that there was enough intentional education about its impacts past one specific area that I think people get hung up on. So that to me is a positive for the future. The second thing that we're working on is kudos to some of the federal, the federal government and the state. They have some workforce capacity grants coming down the chain in this fiscal cycle at the federal level that all departments within the state will benefit from. And our Commissioner of Health is taking the lead in working with the state around those workforce capacity grants. We hired a full-time, you heard me complain that I never had anyone dedicated to grants for the full time I've been here, which is almost 2 years. And now we've had someone onboarded for the last month, and she's also hit the ground running. So shout out to Anita and our commissioner who'll be working with the state on workforce capacity. The last thing is I was invited to serve on the National External Advisory Committee for Washington University's new public health school. And I have been very assertive, very clear about my intentions for them to prioritize public health and health equity in a way that is clearly seen from its start. And so they've been great about meeting with me separate to those meetings around what that looks like from a funding perspective. And there's innovative work ideas around increasing workforce capacity that I'd like to see built into that school that we can mirror at all of our academic centers, specifically supporting high percentage of salary through those schools for faculty who are embedded in our departments. And so that while there's turnover in their students, they sort of drive the ship of bringing those services into the health department on a more long-term basis than interns who are not helpful to us typically serve. I can also announce that I, in partnership with Dr. Elvin Gang, have also approached our only HBCU, Harris Stowe, about a $250,000 commitment through a grant application that we're applying for to bring interns, long-term interns, 1 year to 2 year interns from Harris Stowe to be embedded directly within the health department. So I think those examples of things that we can pilot and grow on MBAL are where at least I'm trying to start. But I do come back to, after being positive and giving you all the good things that we're working on, that if we don't increase salaries for civil servants within the city, this continues to be an issue because we're non-competitive, which drives the lack of retention, but which also dilutes the quality of the types of people that we desperately need and that I know are out there. Because we're now a nationally renowned health department, when we have virtual job fairs, we have people, master's level people from across the country that want to come here. We just hired 2 people that have been willing to move from other very far away states to come work here in the next 2 months. And so people want to work for us. People want to work in public health, but we can't ask them to do that at the detriment of their livelihood and their families. So it's the salary piece that we need the highest level of advocacy for. The mayor has already increased salaries by 3% last year, and then an additional 3% has been announced this year, which is phenomenal because we haven't seen that from a mayor. But the deficit is so great that there's still a significant dent in how far we need to come. Your thoughts though, Ambal?
Those are excellent. I would just add partnering with St. Louis University too, but we'll talk about that later.
So while I'm pressing on the school, you know that we've been in partnership with the academic health department and the School of Public Health for quite some time. Before people even thought of these ideas, they have brought critical training and infrastructure into our department. And so that to me is a very natural growth, but I do want to make sure that I shout out and make clear that SLU started these types of endeavors to support public health long before anybody else was thinking about it. So the academic health department has been embedded within the Department of Health, bringing critical training for years now. So shout out to them.
Well, and the other point, I just wanted to make sure that you're telling us where to advocate for you all to get, tell us what to do, because we, on the outside, I didn't get to see it. Thank you.
So salaries, and then for those of you embedded in academic health departments, we do not want interns. Interns are useless to us. We're tired of people coming to us to ask us for these partnerships that more so benefit them. We need long-term commitments to building workforce capacity that the universities pay for. And that's what we want and need.
Thank you. Colleen, I see your hand is up.
Yeah, I have a question on the salaries piece. Dr. Motti, since you said 52% of the budget is grant funded, is that mostly programmatic work, or is that also cover a substantial amount of salary support? And if the latter is true, does the city put caps on what you can ask a grant for in terms of salaries?
Oh, Colleen, with the nuanced, intuitive question. Yes, the latter, my friend. Caps. Caps, yes, there are caps. So we are limited in how much, because of equity, we are in a position to greatly pay higher salaries to our grant funded people, but the disparities that causes has necessitated caps. So conversations can be had, because my ability now to increase my grant funding, because I just know that practically going from 1% to 5% in a year is never going to happen. of the city's budget. And so I can get grants and I can pay people's salaries through some of those grants, but the discrepancy in pay would be great if I were to do so at competitive rates. That was your question, right, Colleen? Did I miss another part of it?
That's absolutely right. And, I think, as we work with funders, this is obviously a long term, but as we work with funders, that's one of the most important things I think that we can help them understand is that, there's and non-grant funded people that we also need to think about.
Yeah, and I think that you're completely hit the nail on the head, as does Dr. Bradley in the chat, reminding us about the sustainability issue of grants. So we're facing that right now. Coming out of COVID, some of these granting streams are in jeopardy now, especially with some really difficult choices that are being made. I think some of you may have seen in the news constraints in funding at the congressional level for HIV, specifically PrEP, and how that's now already threatening some of our long term. We're talking about 10 years stable grant funding streams within the department, and people are worried about job security, right? So the sustainability piece is also an issue. So I have been very loud and clear about why, even though I'm told just build your budget through grants as a response by certain people, that is just not tenable or reasonable because of the sustainability piece. But in the short term, yes, we can do that. And be strategic about where it would be wiser to use the grant model in places that we can afford to maybe have a less need for sustainability. But our budget cannot be dependent on grants alone. What a robust discussion. I love this board and this feedback. I don't know if there's more comments or questions, but I love being held accountable. I usually roll up to these casual, but I need to be prepared. You guys are going to be holding me to the fire.
Other questions? I do have some feedback that I want to share because I don't normally share something unless I hear it from more than one source. But I think that there is a lack of clarity from some of our community partners about how expansive the scope of the Bureau of Health will be. There are many folks who really feel like it's only going to focus on the opioid crisis.
Mm-hmm.
And I think that they believe that that's how what's being emphasized or communicated most predominantly in everything that they've seen or attended from the Department of Health. So I'm sharing that feedback that there are folks out there who really feel like, well, this is only for that. So that as you think about future opportunities to share news or communicate about it, there's a way to include some of the other aspects of what it will cover as well.
That's really helpful. And I think Dr. Gary will really appreciate that. To be clear, I can understand how that came about because we had to strategically to get free services from the CDC that was under an opioid grant. So the bulk, the work had to be housed under the opioid crisis. But you're right that even in the relaunch and in communications moving forward, we have to be clear that the work that they've been doing has been still prioritized there because it's a main area of crisis, but will not be exclusively surrounding that. In fact, we are just working with the criminal justice system within the city, for example, and you heard me talk about trainings that are more than just under the opioid blanket. So I think they will continue to maybe see an emphasis, but it's important that we are clear in our communications about the scope of the work, but honest about where they'll see the scope of that work. And that's where I'm limited, right? If we had a CDC team here for a year under the blanket of the opioid crisis, most of their resources were opioid driven. And so it will take a while with a new team of only 5 people to be able to really start showing the work that's outside of the opioid crisis. So I appreciate that feedback.
Okay. Any other questions for Dr. Mahdi? If not, thank you, Dr. Mahdi. We appreciate the update as always.
Thank you.
And we will move to our next agenda item, which is an update from Tim on the Academic Partnerships Committee.
Thanks so much. And you'll notice on the screen that we've been joined by our esteemed Emeritus Chair Will Ross. And I put in the chat the list of the members of the Academic Partners Committee that met in between meetings. And it includes the members, 3 of us from the screen. Well, maybe 4, I guess, myself and Craig and Kristen and Dr. Ross. And a couple people from outside, Spring Schmidt and Sheila Grigsby. So that was one of the goals that we wanted to do, was to sort of broaden the reach of the academic partnership to UMSL and to SLU and to WashU. And so that was achieved. And so in the interest of time, I'm going to sort of summarize what we talked about, and then Will and Craig can jump in as well. We have some notes from this, but we sort of talked in 4 areas that some of the previous focus areas that the Academic Partnership Committee had been working on was in the knowledge research area, including sort of academic partnerships. And, you know, the previous discussion will allow me to short circuit a lot of what I was going to talk about, because your discussion with NBAL was great, because the discussion of the academic partnership with SLU we talked a lot about that and has ground covered. And then the workforce discussion is priority 2, includes internships, but also real solid connections of faculty with the Department of Public Health. And, you know, you articulated that better than I could, Dr. Motti, and, I plotted that in the chat, as you could see. And then public health effectiveness was a 3rd focus area, and then policy. And so we got a good report from Spring Schmidt on what she's doing over at SLU in her funded position to not only keep that academic partnership going, but also work with the state, across the state, with local public health leaders. We talked with Sheila Grigsby, who is really very interested in connecting UMSL in their nursing department with the department. And so we applauded that. So, just to cut to the chase, and then I'd invite Will or Craig to jump in as well. We agreed that, we have a big agenda, but the committee thinks we should start incrementally on things that we can achieve quickly, or we know there are MOUs that are in process or already achieved with SLU. There's one being worked on with WashU. There was an expression of an interest in one with UMSL around the nursing department, and talked about Harris Stowe as well. Developing partnerships, just maintaining those partnerships with universities and other state partners. How to develop the infrastructure, connect to the universities. I think COVID told us how important that was, and how do we not let that die down. Some of the research interchanges, and the challenge you put on us about the internships is another one that we need to keep talking about. And then the policy work to enhance the funding locally and then the state for public health, Medicaid, and other things, and some of the work that Spring is doing around public health around the state. It's some of the things we talked about in the short run, but that's certainly not the longer term agenda, which is also about funding. Anything to add about to that, Will or Craig?
Well, thanks. First of all, it was great to see all the faces here. And I know wonderful things are continuing to be done at the Department of Health. I would just highlight a few things, particularly around the funding. The academic collaboration will allow not just an increase in local and state funding, but it will allow us to leverage national funding. Because of our municipal structure, we really are prohibited from accessing national grants. It's quite a limitation, and so we wouldn't have the best ability to do that until we are actually structured as a region. But that's actually a long-standing development. While we're waiting some more extensive regional collaboration. This academic public health collaboration will allow the feds, whether it be CDC or any other organization, to see that we really are speaking as a unit, as a region from our academic centers. That could be profoundly impactful in terms of the funding we could leverage into St. Louis. Secondly, I absolutely agree with Dr. Maddie regarding the workforce. We have always emphasized the desire to have interns here, but she's absolutely right. You're absolutely correct. We need to ensure that there is a sustainability in that workforce. I've had this conversation with Bill Powderly at WashU, and we've had students inquire about internships, and I said, we have this discussion ongoing. I would like us to continue to elevate this to the point of having formal professional development for the academic medical centers, but also, as you mentioned, Dr. Maddie, for the health department. So there really would be a mutual collaboration around professional development. And I think, lastly, in addition to the funding, in addition to the professional development, you can only imagine the amount of new knowledge that we could produce. I want to commend Inbal at SLU for her phenomenal work for many years. Thank you so much. But together with SLU and WashU, we have those MOUs. MOU from SLU is signed. MOU from WashU is pending. We're optimistic, and we should move forward with that fairly quickly. But when we include University of Missouri St. Louis, think of the intellectual capacity, the firepower that we could have collectively, and what we could do in terms of really producing new knowledge, getting productions and manuscripts and literature. So again, powerful impact. I'm really optimistic. I see this moving forward at a good clip, and so let's just keep that motion going on. So thank you.
So Serena, if I can quickly interject. So thank you. I did want to add that Spring Schmidt, who is a true advocate for this collaboration and was involved obviously with the academic health department, is with the Missouri Center for Public Health Excellence, and in that position was very clear about her advocacy for these collaborations and the funding aspect of this, which I think is truly incredible for this. And also to point out that we in this health department and the health department in St. Louis County, together with SLU at the time, and now as we move forward with the expansion to our great many institutions in this community, are the only academic health department in the state of Missouri. So we have a tradition to build on and expand greatly.
Agreed, Craig. Yep. And thanks, Will. Any questions? I was allowed to abbreviate my report because of that great discussion that Inbal and Dr. Mahdi had, but I'm glad you brought up the city-county academic partnership. We talked about that as well.
Okay. Thanks, Tim. Our next agenda item is the Governance and Nominating Committee. Linda?
Thank you very much, Serena. The Governing and Nominations Committee met on June 28th. As I think you know, we are working on the process of filling the 6 board vacancies we will have coming up in 2024. And we will also be needing to elect in the spring of 2024 a new board chair for this group and a new board vice chair. In the past, we have typically elevated someone who is an existing board member to the board chair and vice chair positions. And so we will be in conversation with Tim and Serena and Dr. Mahdi about how they would like to proceed with regard to board leadership. We are mindful that the department has just finalized its strategic plan going forward for 2023 to 2027. And we've been looking at that in the Governance and Nominations Committee to help guide the subject areas in which we need expertise in the future going forward. The priority areas called out in the strategic plan are advancing health and health equity, solidifying our foundation, modernizing data infrastructure, and expanding behavioral health. Our committee also talked about wanting to focus on teen populations and increased violence in our city, and include maybe some of those on the ground community providers who are dealing with those issues in our board ranks. On a practical level, we have come up with a few names amongst ourselves of community professionals, many of which are probably familiar to all of you, to whom we will make some informal inquiries. And shortly after this call, I hope to send out an email to all of you, formally asking you for some names or suggestions of potential board members for next year. So in that email, I will provide also a list of, or a chart actually showing the competencies of the current or the board members who are current and who will be remaining on the board in 2024. So you can get a sense of what skills we have and what skills we may need in the future. So it's a lot of work, six board recruits. Our process is that the committee receives nominations from all of you and from our own membership. We will have at least a one-on-one interview with each of those candidates to give them get a sense of their level of interest and commitment. And then we discuss them sort of as a commitment, and then bring them, if appropriate, to you as a nominee for a full vote. Well, we present the slate to you under the bylaws. We present the slate of nominees to you in October, and then we vote as a board on this in November. Their new terms commence in February 2024. I'm happy to take any questions, but as I say, please wait for a follow-up email from me seeking your ideas for board members going forward. Thank you.
Thanks, Linda. Any questions for Linda? So I have a question, and I know that just the nominating component is going to take up probably all of your bandwidth. And I saw that there was a group that was recently appointed for the city to look at the charter. I don't know what the timing of that work is, but I know at one point the governance committee also looked at some changes to the city charter that we might think were important for the Department of Health. This might be a Dr. Monty question or a correct question, but is that group on your radar for the timing of that and when we should be prepared to have any recommendations that are germane to the Board of Health and Hospitals?
Well, we are ready to go on that issue whenever you need it, Serena, because we tried previously to convince the mayor's office that we really needed to amend the charter, because as anybody who's looked at it recently will know, we are under the charter, we are deemed the Board of Health, and then it's a separate Board of Hospitals. And of course, we don't oversee any hospitals anymore on this board. So that's really sort of the main thing that needs to be updated and clarified. We have looked at that we've looked at that under a microscope. I have a detailed memo on that I can send to you. If and when the mayor's office wants to move forward with that, we understand the process is that the issue has to come up as a board bill before the Board of Aldermen and be approved before it can go on the ballot for a full city vote on changes to the charter. So it's a heavy lift and it's a big deal. But we need some sort of commitment from city leadership to get the ball rolling on that. So far, my last recollection was that the mayor's office wasn't quite ready yet to spend their capital on this. But, you know, hopefully with this new endeavor that you mentioned, Serena, maybe things will move forward, but we're ready.
Thanks, Linda. Yeah, I think this new committee might be a different avenue to present this to them, because I believe they'll be making some overall citywide recommendations. Tim, I see your hand up.
I know we're past time here, but one recommendation I made, and maybe this is something the department can monitor, is that this may not be the highest priority for the city to fix this charter, this piece of the charter, but it's kind of messy for our board. So one recommendation I made was that we look for other places the charter needs to be fixed that might be higher priority, and sort of slip this one in. So if that's possible, and then, you know, then it could, you know, might actually be, you know, ready for prime time for the ballot. So maybe there's other things that are needed to be done to the charter, and we could add this one as, like, people will go, oh yeah, okay, well, we don't have a hospital, so yeah, okay.
Yeah, so there's a committee that's looking at the entire city charter. So what I'm saying is, to your point, Tim, as they're putting together their comprehensive set of recommendations, that we can share with them what we've developed.
We haven't been approached as cabinet yet, at least at the departmental level. So it could be that they're just too early and they intend on including us to provide our list of priorities, or it may be that they're working on internal priorities. But at the next cabinet meeting, I'll make sure to ask what the process will be so that I know how to prepare and what to submit. And it would be helpful if both the board and my managers start to be thoughtful about what they'd like to see within policy reform. Craig Schmidt, as our leader in policy, will obviously take a key position in helping us to both be thoughtful about what those changes need to be, but also in gathering what folks here and within the department would like to see. And then I'll report back at the next Board of Health meeting, because I'll have had a cabinet meeting between then to be able to ask what the process is and when they will be engaging us. But just the fact that we've gotten to the stage of having a formal committee is very hopeful.
Thank you.
Yeah, and
All
I'd be happy to send around a copy of the analysis we did previously about the charter, just to refresh your recollection. You know, you, Dr. Mahdi, Serena, Craig, Tim, you know, just kind of walk you through where we were, how far we've come to date. So thank you.
Thank you. All right, any other questions or comments for this committee? If not, the Community Engagement Committee has not met. So I will try to send out another scheduling poll to see if I can find a date where everyone is available, because so far no one is available at the same time. But if the other two committees can do it, we can get it done. So that will be a goal, to try to get that scheduled this month. Any announcements? Oh, I sent it to you, Corey. I'll resend it.
I'd like to come back. I've got such a brilliant team that when you brought up your point about the feedback for the Behavioral Health Bureau, they missed it by just a couple of, like, less than a minute. But I just want to share screen on a list that they immediately sent. And I'm only doing this to take advantage of the fact that we're a publicly broadcasting group. But this is in this report and in every report that we have. So that'll be one modality that people need to just pay attention to. I'll also talk to you, Serena, offline about more other ways that I could maybe better the communication about what they're doing. But this is just the list from this month of the things that are outside of the opioid crisis that the Behavioral Bureau is involved in. So we have entered into a grant with Casa de Salud to work on mental health, specifically within and communications around mental health. services within the immigrant and migrant community. So this is the Casa de Salud Build Grant collaboration focusing on mental health services for the refugee population at their South City clinic. And we will partner with Casa to promote behavioral and mental health material that is culturally and linguistically responsive, provide guidance and support in creating and distributing culturally and linguistically responsive materials, promote the materials, and collaborate on outreach specific to the migrant and immigrant community. They've also been working with the criminal justice, crisis response, safety, and resiliency portions within the department. They have an active representation on the following committee: the City of St. Louis Criminal Justice Coordinating Council, Alternatives to Incarceration Subcommittee, and the Crisis Response System Leadership Meeting. In June, they actually completed, Dr. Julie Gary completed a scope of work for all medical and mental healthcare in the City Justice Center, which has never existed, designing an organizational chart for the mayor's office's consideration to provide a chief medical officer and other critical positions in the future budget to allow. Right now, as shocking as this is, no health or mental health services outside of the Department of Health run through me or the Department of Health. And so this plan that we have put together, that Dr. Julie Gary has drafted, that I have approved, is going to the mayor's office actually tomorrow for their consideration. So this is a mammoth amount of work. An organizational chart, a patient safety policy for the City Justice Center, a Behavioral Health Bureau team, has also been working on ride-alongs with counselors from the BHR and the City Metropolitan Police Department. As I said, they're also working with DHS to train public safety members. And then the last part that they've been working on in the last month is linking jail inmates to behavioral health services. This is outside the close to 10 community outreach events that they've been involved in, whether it be on our bus or in partnership with other committees. So again, we'll be thoughtful about better ways, but I just wanted to publicly let people know the scope of work that they've been working on already. And this is just with 5 people. They're onboarding. I think they've just hired 2 to 3 more people, and they're interviewing for another, I think, up to 4 people. Serena?
Did you just say that the City Justice Center doesn't currently have a chief person that's responsible for medical and mental health care? I might
So
have
they
missed-
have medical and medical health care, but there's never been infrastructure in place to make sure that that's overseen by the only doctor in the city, who is me, and the Department of Health. So we have we've done research into what other health departments do and use national guidance and standards to produce a comprehensive plan to submit to the city's mayor's office so that there's better internal regulation. So yes, there are consultants, there's teams of people who come in to do this work for those people, but there's no internal regulation currently through
Wow,
department.
that's very important. I'm optimistic that they take those recommendations, because that's a significant gap.
Yes.
Yeah. Tim, I see your hand up.
Well, and I know we're over time, or I think we are. I don't really.
Saying that, we're scheduled.
You
to
keep
go-
saying that. We're good.
Oh, okay. On that particular topic of the jail, you may know that one of my many board appointments is to the Justice Services Board in the county.
Mhm.
And they, as you probably know, to their credit, they've actually created a mental health unit in the Justice Services in the jail. And I think that's great. And it's pretty new, so we don't know how it's going, but frankly, just having it is really important. And I think they reported to us that 40% of the people that come into the jail have mental health consideration. So they have, obviously they've had really good health services that are provided in the jail, run by Kanika Cunningham and the St. Louis County Board of Health. And so speaking to your point, that they've been actively involved in running that clinic. And then now they have this great idea of, enhancing the mental health services. So we've been applauding that work on the board there. And so I think sort of paralleling this at the city would be fabulous, because sadly, because of, the state of our world, but especially our state and how underfunded mental health is. Unfortunately, jails are maybe one of our lines of last resort or first resort for mental health services. So
Yeah, couldn't agree more. And so I work very closely with Dr. Cunningham, as you know. So we actually got all of their policies, their table of organizations, their procedures, in addition to some of the national standards that we also researched and what other health departments do, and that worked into this plan. You know me, I'm big on alignment regionally. And so Kanika and I take that very seriously. So I applaud their work, obviously, because this hasn't even existed at the basal level yet. My focus is on just getting a foundational infrastructure in place. This costs money, right? And so I anticipate that even though the full scope of what we think was going to be needed long-term would be close to 9 positions, we know that we likely would start small. And so we've even provided them with what that could look like in building this out. But my goal is for us to have in alignment what's happening with the county, and then continue to really make sure that mental health services are supported in the criminal justice system. But to be clear, they are subcontracted and contracted work. My concern is around coordination and internal review that should exist because it exists most other places. So.
Thank you.
And Dr. McBride, I'll tell Dr. Gary to reach out to you as a resource too, as we continue this work. But I'm glad to see that they are already hitting the ground running and that we prioritize our criminal justice system.
thank you, fabulous. Be happy to do that.
All right. Are there any other announcements? If not, our next meeting will be August the 17th. Somebody put in the chat about getting the calendar invites. I know that sometimes those don't come out or they're delayed, but just as a reminder, we're always going to meet on the third Thursday at 8 a.m. So unless, we have to change it for some reason, but if you set up a regular calendar invite for yourself, that will make sure that you don't kind of miss a meeting in case the reminder doesn't come out when we expect it. All right. So we are adjourned. Thanks, everyone.
Thank you.
Thanks, everybody.